Fentanyl is a potent synthetic opioid analgesic with a high affinity for opioid receptors in the central nervous system. Here are some key points about its pharmacology. 1. Mechanism of action. Fentanyl primarily acts as an agonist at opioid receptors, which are distributed throughout the brain and spinal cord. Activation of these receptors results in analgesia, pain relief, sedation, and a sense of euphoria. 2. Pharmacokinetics. Fentanyl is available in various formulations, including patches, lozenges, injections, and nasal sprays. Its pharmacokinetics involve rapid onset and a relatively short duration of action. It has a high lipophilicity, allowing it to cross the blood-brain barrier quickly. 3. Metabolism. Fentanyl is metabolized primarily in the liver by the enzyme CYP3A4 to inactive metabolites, which are then excreted by the kidneys. Genetic variations in CYP3A4 can affect fentanyl metabolism in individuals. Intravenous for fentanyl. For anesthesia. Typical initial doses range from 1 to 4 micrograms per kilogram mcg per kilogram of body weight. For acute pain management, initial doses can range from 25 to 100 micrograms mcg, with adjustments as needed. Transdermal patch fentanyl. For chronic pain management, the initial dose is usually 25 micrograms per hour mcg, or for opioid-naive patients, the dose may be titrated upwards based on the patient's response and tolerance, but this is typically done cautiously over several days. Intranasal fentanyl. For breakthrough pain, the initial dose can vary but is often around 50 to 100 mcg per nostril, with the option for repeat dosing after a specific time interval if needed. Buccal lozenge fentanyl. For breakthrough pain in cancer patients, the initial dose typically ranges from 100 to 200 mcg, with adjustments as needed. Fentanyl, like other opioids, can have various side effects. The most common side effects of fentanyl use include 1. Respiratory depression. This is the most significant concern. Fentanyl can slow down breathing, and in high doses or with misuse, it can lead to life-threatening respiratory depression. 2. Sedation and drowsiness. Fentanyl often causes drowsiness or a feeling of being sedated. It can impair a person's ability to concentrate or operate machinery safely. 3. Nausea and vomiting. Many individuals experience nausea and, sometimes, vomiting as a side effect of fentanyl. 4. Constipation. Opioids like fentanyl are known to slow down the digestive system, often causing constipation. This can be a chronic issue for individuals on long-term fentanyl therapy. 5. Dizziness and lightheadedness. Fentanyl can lead to feelings of dizziness or lightheadedness, which can increase the risk of falls and accidents. 6. Itching and skin rash. Some people may experience itching or develop a skin rash as a side effect of fentanyl. 7. Sweating. Excessive sweating, often accompanied by cold and clammy skin, can occur. 8. Confusion and cognitive impairment. Fentanyl can cause mental clouding, confusion, or disorientation in some individuals. 9. Decreased appetite. Loss of appetite is another potential side effect. 10. Dependency and withdrawal. With extended use, fentanyl can lead to physical dependence, and abrupt discontinuation can result in withdrawal symptoms, which can be quite uncomfortable. Fentanyl can interact with various medications, potentially leading to dangerous side effects or reduced effectiveness. It's essential for healthcare providers to be aware of these potential interactions when prescribing fentanyl. Here are some of the most common drug interactions with fentanyl. 1. Other central nervous system CNS depressants. Combining fentanyl with other drugs that have a sedative effect on the central nervous system, such as benzodiazepines, e.g., diazepam, alprazolam, other opioids, muscle relaxants, or certain sleep medications, can increase the risk of severe respiratory depression, sedation, and even overdose. 2. Monoamine oxidase inhibitors. MAOs. MAO is our class of antidepressants Combining fentanyl with MAO can result in a potentially life-threatening condition called serotonin syndrome, characterized by symptoms like agitation, hallucinations, rapid heartbeat, and high body temperature. 3. CYP3A4 inhibitors. Fentanyl is metabolized in the liver by the enzyme CYP3A4. Drugs that inhibit this enzyme, such as certain antifungal medications, e.g., ketoconazole, itraconazole, and some antibiotics, e.g., erythromycin, can lead to increased fentanyl levels in the body, potentially causing overdose or respiratory depression. 4. CYP3A4 inducers. Some medications, like certain anti-seizure drugs, e.g., carbamazepine, phenytoin, can induce CYP3A4 activity, potentially reducing the effectiveness of fentanyl. 5. Anticholinergic medications. Combining fentanyl with anticholinergic drugs, e.g., certain antihistamines, tricyclic antidepressants, can increase the risk of severe constipation and urinary retention. 6. Serotonergic medications. Certain medications that affect serotonin levels, including some antidepressants, e.g., SNRIs, can increase the risk of serotonin syndrome when used in combination with fentanyl. 7. Medications that affect blood pressure. Fentanyl can lead to changes in blood pressure. Combining it with medications that also affect blood pressure may lead to unpredictable responses. 8. Anti-anxiety medications. Combining fentanyl with medications used to treat anxiety, panic disorders, or other mental health conditions can increase the risk of sedation and respiratory depression.